Hey, doing well. Tell me, what can I do for you now?
Basically, you know the rhinoplasty?
Yeah.
Can you get me the results I want, do you think?
Yeah, I've mentioned 5 things we can do.
Yes, so I've got them all here. So it's the
Okay.
genioplasty, the angle
Osteoplasty. Yeah.
the rhinoplasty, the buccal fat removal, and then
Yeah.
you can do a bit of lipo. And
That's going to happen the same time I've mentioned, at the same time as we do genioplasty. And I've said 5 millimeters horizontal only, and we're going to do minimal liposuction.
Do you think 5 millimeters is a lot on my face?
No, it won't be a lot. See, because we have to consider the fact that you've given fillers.
I have fillers, yes.
Yes.
Like, I did my
And on the
fillers.
scan, it doesn't look more 5, it looks minimal.
Yeah, well, how much do you think you should do it then?
Minimal, 5 is enough.
I don't want more than 5, but I mean, like,
No, I won't do more than 5. We'll do
whatever
5.
you think looks normal.
I think 5 is what we decided from the scan, so we'll stick with that. And also,
4, I think you said.
I've written 5. Yeah, we can do 4 if you want. 1 mm, I can do
Yeah, it
less.
doesn't really matter that much. But yeah, okay. Hold on. You know the filler?
Yeah.
Is 1? Yeah, I guess it's 1 millimeter. It's
1 cc.
1 cc is 1
See,
millimeter.
the filler problem is we can't correctly predict the amount that's there. But when we look at your scans, the chin is really, I mean, it needs augmentation for sure. This is not your scan, but we can go to yours. And with regards to the nose, we've set 5 points.
Yeah. Do you think you can achieve all 5 points?
I think so, yeah.
Okay.
Surely. So we're going to address your blocked nose on the left side a little bit. There's a spine there inside.
Yeah.
Then we're going to get the septal shore fixed. We're going to get a little bit of a tip plasty. Then the dorsum height is going to be the same as that. You don't want to do anything to increase the height. No width, no nothing. Just
to the width.
You didn't say that last time.
Oh no, I know, I didn't.
You want me to add that?
Basically, there's a photo of this.
That's what I suggested.
I know. There's a photo of this girl. Where is she? This girl, she's had buccal fat removal.
That's looking exaggerated. You really want me to do it like that? She doesn't look beautiful.
And she doesn't look beautiful. No, I don't want that much buccal fat removal.
Yeah.
I mean, like her nose.
But what buccal fat does is just this. I told you it exaggerates the malar bone and the gonial angle.
Yeah, I do want it.
So we'll do a little bit. You said 50%.
Yeah, 50%.
Yeah.
So that's that. But her nose, if you have a look, it's obviously you can see. Like this bit's a lot thinner than that bit.
You like it like that?
I want this bit to be a bit thinner than this bit, but like whatever you think. How do you do it? I was going to ask you a question. I was going to ask you something else as well that my dad said to me once. I was wondering, could you possibly draw me 2 lines on this page that are the same?
Meaning?
Just 2 lines. Draw 2 lines that are the same.
Like this or like this?
Like just anyway. Can you draw me a circle, please?
On this?
Yes. Okay, that's good. I just want to see how your drawing was.
My drawing is bad.
But you have to draw.
Where?
On me.
No, I'm going to do the surgery on you. It's slightly different.
Is it not the same?
No, it's not the same. Because...
is it not how good you can draw?
No.
Or how good you can?
No, not at all. The reason why it's not the same is because you are drawing with a pen and here there's no anatomy. For a surgeon, you remember the lower lateral cartilage. I cannot change your nose the way it is. I have to use the anatomy. That means I have to get to the lower lateral cartilage. I have to go to the septum, precisely dissect it, then release it and then move it. Okay. It's not like drawing on a paper. No, not at all. And even when you're doing genioplasty, it's working within the limitations of the anatomy and knowing how to reposition those tissues without causing damage and doing it very subtly without tissue damage and everything.
Yeah.
And it's a combination of, now I told you on the scan, the spur. So it's a combination of knowing where that spur lies and how you go there and how you remove it. And then how you gonna close it and make sure it doesn't collapse, to how you're gonna reshape it, all of that. So what I generally do is these notes stay with me on the table, on the OR. But the nose work or anything like this is mainly out of experience and about doing a lot of these cases that you get the fine things fixed.
Okay. what I was going to say, what could you? Because I'm umming and ahhing about the nose. But if you did you widened my upper jaw, how would you do that?
Sorry, I'm sorry. If I have to widen your upper jaw, then we can do it in surgical, or we can do it by means of orthodontics or expansion. Surgery, I can expand it by doing an osteotomy in the center of the jaw, just splitting it open.
Splitting it open and then putting it back together.
No, and then keeping a plate in between, so you'll have a gap between the.
I will have a gap, so
Yeah.
I have to have.
Then you have to get braces after that.
braces after that.
There's no other way you can do that.
There's no other way. Okay.
The only thing, this is faster than if you have to do it only by Sharpe. Sharpe is like a technique which is like a rapid expansion of the upper jaw.
You have to.
Yeah, keep turning the screws. It would still take many weeks. There's no other way of doing it, unfortunately, apart from these.
Yeah.
But why would you want to widen your upper jaw? You don't need that.
I guess I just.
No. What you need actually is a vertical maxillary reduction. Because when you showed me those pictures, and also the scan, you have a mild, maybe 3 to 4 or 5 mm of vertical maxillary excess. And that's why you feel when you smile, that's when you see on the sides and everything, it makes the face look a little bit longer. But that's a bigger surgery. I would not personally recommend it also for you.
No.
But that's what you have to understand.
Okay.
That there is an underlying anatomical issue or rather imbalance which we're not willingly wanting to address because it might change the aesthetics or your facial balance in a not so nice way. And you're tall, you're well built, and so it doesn't matter if you have a little bit of a gummy smile. That's one point. The second thing is, see, when you rotate the upper jaw, the nose also gets affected a little bit.
Yes.
It does get affected. I do what is called as a concomitant rhinoplasty to make sure that the nose doesn't get affected if I have to, or if I want, I do it in such a way that the nose gets a better shape as what we want. But still, you have to understand when you do any upper jaw surgery, the nose, without an exception, gets affected because it's on the upper jaw.
Yeah.
So therefore, because you like your nose a lot, I mean the way it is, just want subtle things in the tip which are all like 2 millimeters.
You know, with the tip, how are you actually going to do it? Is it like a slicing? Do you slice it?
No. So the tip is made out of lower lateral cartilages, and your lower lateral cartilages are like this.
Yeah.
So we need to get it closer.
Yeah.
And once you get the cartilage closer, the skin just drapes on top of that. Yeah, so you really don't have to excise anything.
You don't have to like take off any of the
No.
You don't take off any of the cartilage?
Not on the tip, no. We reshape it basically and we move it together, and so that the tip, your tip is like this now.
Can you make, sorry, go on.
Yeah, so your tip is like this, so I'm gonna get it close like this.
Can you make this bit so it's more prominent?
So we'll have to put a graft then. We have to take a rib or some
No,
piece and put inside.
There's no point in doing that. When you bring this closer, this will obviously become more prominent.
No,
No.
the tip will be more prominent, and then it won't be this broad, the tip.
The tip will be broad.
It won't be.
It won't be.
It's broad right now.
Yes, it's broad right now. Let me just have a quick look. It's broad right now, and then it'll just come closer. So when you do bring it closer, this bit will go in. Because I really like how it goes like this.
So I won't alter that.
I like it a lot.
So we let it remain.
Okay.
It's
I feel confident with everything, and I feel like confident in your skills because it's like a big thing to like let someone
get your things.
work on your face.
Yeah, don't worry about all of that.
Okay. I asked the guy, I said, has anyone died? He said,
No.
Not one person. So I
No.
thought, not one person's ever died.
No.
No, okay. Well, that's
See, the reason is because we will not take you up for surgery, if that's the case. If you're not medically fit.
Yeah.
We turn down a lot of our patients. That's why if you see, we are having predominantly younger age group people, less of the elderly people, because most of them get unfit for major procedures under general anesthesia, and we don't like to take a risk with them.
Okay. I feel good about everything. I feel good about it's obviously very expensive, but like I can do it. I can just about do it. I have no money to like go anywhere or do anything, but I can just about do it.
Okay.
And yeah, you think that woman, it doesn't look good, the buccal fat removal. I don't want it that much, but I want a little
Yeah.
bit.
I think we can do 50% like what you said,
Yeah,
or
what we
it's just a
said.
minimal thing.
Yeah.
That should be fine.
Okay.
And
Yeah.
you want to see the buccal pad that I remove, like we can take a video and keep it. I'm just asking.
Okay, yeah.
If you want to see everything that we do, we can record all of it.
Yeah, I don't want to post it anywhere if that's
Yeah.
okay, please.
So we can see the surgery thing is inside the mouth. No one knows who you are. It's just for records. Two things we record everything. One is for a post-op. So for example,
I can't believe you do this. This is crazy what you do. Like you open people up. I don't know. Anyway, go
yeah.
on.
So the good thing about recording is, you have a lot of data for use later on.
Yeah.
So for example, if we of course document in the notes that like we're gonna do this much, we're gonna do this much in the surgery notes, but nothing is like documenting a video. I mean, you really know what you've run, you really know what you're removing, you really know how you're reshaping and everything else. So I think it's a very nice document. And one of the things what we can do is, the patients are interested, we can show them we can show it to you, just like a proof of the pudding, like that you see what's happening. Yeah, it's a fact. Because in many corporate hospitals where I function, where I work, where what's happening is, there's one thing on the front and then there's another thing that happens inside. You really don't know what happens. It's, the actuals, like, okay, who's draping, what's happening, how is the incision made, is it actually 50% that's removed, or stuff like this. How much of bone was actually removed? What's the bone actually removed?
Yeah.
These are all things that we like to document if the patient's willing. I do it because
Oh, no, I think it's a good thing.
yeah.
I think it's a good thing.
And the second good thing is why I document. The first reason I told you. Second thing is, we have a lot of doctors and surgeons and dentists and other professionals who want to learn. So when you record these videos, we have a site called surgeoncut.com. It's not for the patient's identity, but for the procedure that gets stored.
I know, but I know a few surgeons.
So they see, oh, okay, so this is how you got to do. Okay, that's the nerve. Okay, that's the tooth root. So how do you avoid? How do you retract? How do you go about? What words do you use? I mean, there's a whole lot of learning for the youngsters. So that's like giving back to people. That's the second advantage for recording videos. If you still do not want, I will tell my crew not to record. That's your option.
I would like to record, but I don't want it to be anywhere.
It'll be in some
okay, some
or for our back end, or for like a surgeon cut where you cannot see your identity probably, but the surgery will be there, because then only we can go back and take it in case you need after a year or two.
Okay, that's fine
That kind
then.
of a thing.
That's fine, and we'll
Yeah.
do it. But no on the YouTube
Sure.
videos. Okay, thank you. Okay. I would like to get some. Do you think if I get like a little bit of cosmetic dentistry? I have a crack on one of my teeth. I don't know if you can see. So I'd like that to be like covered over.
That's easy.
And then I'd like this tooth to
Yeah.
have more of a.
A show. For that, you'll have to get a little bit work on the gingiva, or you want the tooth to come out.
I just want like it's the equivalent of having braces. Like I
Yeah.
just want some caps,
Oh, okay, like a veneers.
like a
Those are called veneers.
veneers.
Yeah,
But no,
like-
no shaving of the teeth.
So then it's an add-on. I think
Yeah.
they would put some material and just cure it with a
Yeah.
chemical. But that's not going to last long. Maybe a
Not
few
long.
months or few years at most. It's not long lasting.
Yeah, that's fine.
That's fine. We have a very good person
Yeah,
for
you
that.
do have.
So she can take care of that. Just tell her what you want.
Is it someone you know? Because I think she has the same last name as you, Shweta.
That's my wife.
Oh, that's nice. That's nice.
But she's not my wife. She's not here. This is
Okay.
another person.
Okay. No, I saw on the.
Yeah, she does all of that. But my son is now in his 12th. So that's like the main year before you go to med school. So it's a lot of effort and focus on
What do
him.
you want him to do? Do you want him to do what you're doing?
Oh no, it's just he decides. I mean, see, I'll tell you what. Many things in India are in the extremes. I like to tell people that in India we live in centuries. In the sense, you would find many of us living like how you would live in London or New York, like at the cutting edge of everything. And then there are also people who would live like how they lived in the 17th, 16th, whatever centuries. Seriously, and all of us live together. I'm not kidding. So there's one person who would worship the cow, and the other would be like, well, there's no God. And there's a third one who says, this is that, this is that. Everyone just coexists. So with that in background, so my family and ours is like, I can't tell my sons. It's pretty much like probably in your case or in the US. I can't tell them. They just say, no, I want to do this. And so we just support them, stuff like that, like what I did. So, yeah, in some Indian families, the kids are
Has to
forced.
have a certain job.
Yeah, they're forced into some stream. But in our case, it's not the case. So we just want to let them do what they want to do. And then also here, in India, the one good thing is that, see, in the West, for example, if you want to do medicine in the US or something, so there's a lot of debt you incur as a student because of your university fees and everything. So in here, the first difference is taking that kind of debt as a student is difficult because the banks are not going to pay you. So that's a little bit not there. So the parents come in and do that part. So yeah, so we basically pay up like how my dad paid for my education. So like I would do that for my kids. So basically, so if he wants to do something, then he goes there and be like, okay, so I'm going to pay all your blah 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 fees. So that's a big responsibility these days because it's pretty expensive.
It is.
It's very expensive even in India medical school. Yeah, it's expensive and it's 5.5 years. So yeah.
5.5 years.
Yeah, 5.5 years.
Oh, that's true.
Yeah, and that's just your basics, and then you go on to do your masters, your super specialization, and so after a while, and then you have a system where you get paid for your work while you learn. But when you're really the basics, you have to pay to learn. So yeah, my eldest son is in his first year med school, and my second fellow is in his last grade of schooling.
So you got 2 boys.
I have 2 boys. Yeah.
I bet you're so happy.
No, I have a bunch of more kids. I don't have a problem, but I have 2 boys. That's it. I like kids.
Yeah, same.
It's good fun to be with, and you always feel younger. You feel nice, yeah. So that's what my wife is doing now with my second son because he has a whole lot of things happening. So you know what? It's very competitive in India to get into med school. He wakes up at 5 and then goes for like extra classes. Comes back, goes to school at 8:30, comes back in the evening, has an hour's break, again goes for. So it's a lot of.
Very intense.
It's very
But
intense.
they can handle it because they're young.
Yes, I think
And
so.
they have-
As long as they're interested and they have a longer vision of what they want to do.
It's funny because when you're that age, you're not as mature.
Yeah.
So when you're older, you can study. Like I'm going back to university in September.
Okay. Wow.
And
What are you gonna do?
Civil engineering.
Awesome.
I studied civil engineering before, but I don't have a master's.
Okay, well, you've done your graduation already.
I have my bachelor's. Yeah, my graduation of my bachelor's.
Oh, okay. And you're gonna do it in the UK?
Yeah, in
Okay.
London.
London.
I can't afford to live in London. That's where I'm going to stay in Nottingham and commute.
Oh, okay.
But I'm doing
Still
it
in the UK.
part time over 2 years, so I can still work.
Uh-huh.
So I can afford it all. because
My
it's
dad's a
very
civil engineer.
expensive. Your dad?
Yeah. He did his civil engineering in India and then he went and did his super specialization in the US, in Purdue. He's this expert on structural engineering and tunnels. So he used to do a lot of work on tunnels and big bridges in India. Yeah, civil engineer.
This area is quite well built. The roads are quite okay. I've been to
No.
Rishikesh. It's very
Oh,
good.
Rishikesh. Oh, so
Here-
India is like this. Okay, the south is way developed than the north in general.
Yeah.
And the southern 4 states have a very high GDP, educational systems and everything. Where we are right now, this is a small town,
Yeah.
but we have good literacy, good medical facilities, a lot of hospitals, a lot of schools, everything here.
Yeah.
It's not the same, like I said, all across the country, but in
Yes.
Kerala, it's number 1 in India for all these things. We are at the border of Kerala now. Kerala, Tamil Nadu, Karnataka, these are all the better performing states. They got a lot of reformatory actions immediately after the British. So the states like the Uttarakhand and other Uttar Pradesh, the first 30, 40 years after independence, they don't do much. So they're now doing good work. So it's all catching up.
Yeah.
So there's a lot of work to be done because we have a huge population, and
Huge.
so yeah.
It makes you feel insignificant because there's so many people there. But then you remind yourself that we all have a unique fingerprint.
Absolutely.
So we're all special in our own ways.
Exactly.
All right. So
Done?
done. Thank you.
You're welcome.
And I need to talk to Mijo
Yeah.
about everything. And I need to see a dentist. When can I see a dentist?
Straight away, I guess.
Okay.
I'll just see if they can put you up with her. And also let us know when you would want us to schedule a surgery.
ASAP.
So,
okay,
so tomorrow maybe. If it's ASAP, we could do it tomorrow or the day after that, but not on a Saturday. So.
Okay. I need to think about this for 5 minutes. So
Take your time and let us know if you want it tomorrow or if you want it the day after.
Tomorrow.
Yeah,
So Thursday
that's fine.
or Friday. Maybe Friday.
We have 2 more days.
Maybe Friday.
Oh no, tomorrow is Friday. Today's Thursday, right?
No,
Today's Wednesday. We have 2 days, no problem.
So either tomorrow.
You can even do it on a Monday. I mean, it's up to you. Just
when
when
this week. Can't believe it. Though. It's a bit like wow.
all of a sudden.
So yeah, either tomorrow or Friday.
Sure. Let us know and then we'll plan accordingly. सहारा से मिलाना इनको दांत में कुछ फिलिंग्स डालना है, डायरेक्टली अंदर लेके बिठाओ और सारा को बुलाओ.
I have a card and everything. No, like just the card. Like I'm really here. Okay, sure. That's fine. Is this recorded?
I don't think so.
No.
Prince ko bulao. We were recording something else earlier here.
Yeah. Okay. I was just
So, okay.
Thank you very much.